Hi all and welcome, and thanks for joining us for the July 2025 RR-CLaN seminar. My name is Dr. Alex Stevenson. I'm the Director of Research at Northern New South Wales Local Health District. Today I'm thrilled to be joined by Shaun Grady, who's the Senior Health Informatician with the Hunter Medical Research Institute. And today Shaun will guide us through a presentation on Survey Smarts, finding the best fit for health data collection. To officially get us started, we acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians of the culture, their connection to country, and their contribution to the life of the regions where we're joining from today. We pay our respects to the ancestors and elders of the region and to all Aboriginal people past, present, and future, and to any Aboriginal people that may be joining us today. For those of you that aren't familiar, the RR-CLaN is quite a large collaborative partnership now. We include pretty much all New South Wales local health districts and also the Health Education Training Institute. We include several hospital health services and entities in Queensland, and we've grown organically such we've got people attending from other states and territories and even internationally. In terms of past or previous sessions, we upload all of our recordings to YouTube. So if you've missed any and you want to have a look at them or you want to revisit some of the sessions, please access our YouTube channel using the link in that slide there. Tiny bit of housekeeping. We'll likely have a fairly large attendance again today, so we encourage everyone to keep your microphones on mute, or we'll probably have to do that for you. We're also recording the session for viewing at a later date, so if you don't want to appear in the recording, just simply turn off your cameras. That being said, we do encourage people to ask questions. So during the actual seminar itself, you can ask questions using the chat function, and we'll endeavour to answer them. And if we do get time towards the end of the session, we'll just open the floor up for live questions. So without further ado, it's my great pleasure to introduce you to Shaun. Shaun is a Senior Health Informatician with a Data Management and Health Informatics platform at Hunter Medical Research Institute, and Shaun manages the Data Sciences Research Training Program. Shaun has been developing and delivering research training across Australia since 2019 and is now focusing these efforts on providing training opportunities for researchers in the Hunter New England area and also regional New South Wales. Shaun is originally a radiation therapist by training with specific research interests in role development, clinical process improvement, and utilization of health data. So I'm going to hand over to you, Shaun, and you can take the controls and go for it.
Thanks, Alex.
Perfect.
That introduction. And I'll get started. Thanks for the invitation today to talk. I will start off just with a little bit of an introduction on Hunter Medical Research Institute, or HMRI, for those who are unaware. We're the largest regional medical research institute in Australia, and we're actually developed as a partnership between Hunter New England Local Health District and the University of Newcastle and the community. So our actual physical location is on the same campus as John Hunter Hospital. We've got over 1,700 affiliated researchers and 19 different research programs. Drilling down a bit more, I sit within the research, translation and health improvement stream. So while I come from data management and health informatics, we also have a full biostatistics platform, a clinical trials platform, impact and evaluation platform, and health economics platform to support researchers. Specifically, our data management and health informatics team that I'm part of, there's 6 of us, we look after REDCap admin for HMRI. It's one of the biggest instances in Australia. And we certainly have the largest admin team with 6 of us, about a combined 30-something years of experience between us. We also do a lot of health data extraction, so helping researchers get data out of the health district and into the hands of university researchers or statisticians or any other data analysts. We do lots of Power BI and data visualization things, data merging and de-identification. And from within our stream, we also, I manage the research technology training, which we do lots on REDCap, R and Python, so introductory stuff on that, in vivo. And we also I'll have some introductory statistics training as well that are actually run by our biostatistics platform, so actual qualified statisticians. So today we're going to be looking at obviously survey for use in electronic health data collection. Now, when we think about surveys and surveys tools in a health setting, we really need to think about the different ways or the different types of information we're going to be collecting. So currently in any large health institute or any research group, lots of people will use a particular survey tool for collecting patient registration information, just automated patient follow-ups. There is the HOPE platform in New South Wales Health for PREMs and PROMs, so experience and outcome measures. Lots of individual departments and will run satisfaction surveys. And of course, which applies mostly to the kind of work I do, is in research. Surveys are a huge part of lots of research projects. But saying that, there are almost endless tools to choose from. Now, I will admit I am a bit biased towards REDCap. And I'm generally pretty agnostic to all the others. Like everything else has their pros and cons. So there's tools like Qualtrics and Question Pro, which were very popular. Lots of universities had instances, and then people started moving a bit more to Question Pro. But for the benefit of today, I'm kind of going to group them together because Question Pro developed more as a more cost-effective alternative to Qualtrics, but both originated in the market research space. So they created market research tools in terms of surveys and then moved into a research space. REDCap, obviously, we will talk a little bit about like Google Forms and Microsoft Forms because they do have their place in surveying, not necessarily in research, but they are appropriate to use in certain instances. You may be familiar with something like Lime Survey. That's another locally hosted survey tool. Like I said, I'm going to be pretty agnostic towards these. SelectSurvey.net, I don't like it. But it's another one that's sort of dying out. But was a commonly used survey tool in health districts, and it's starting to die out a bit now. And of course, we've got our classic SurveyMonkey that everyone seems to know. And straight off the bat, I'll say you shouldn't be using SurveyMonkey. If you're using SurveyMonkey for your research, maybe we should have a chat and try and get you onto a more appropriate tool. But given there are so many tools, we need to figure out how to choose the correct tool. So I've broken this down into 7 rough points here, but there's a bit of overlap in between the two, and we'll just go through all these points and highlight how the different survey tools score against these kind of criteria. So when we are choosing our tool, we need to think about obviously our data security, our ethics and government, the functionality and flexibility of the tool, our ability to collaborate, our integration and compatibility with other systems we're using, the help and support available, and is it usable for us as a researcher or a clinician or someone developing a survey? And we kind of need to consider cost as well, and we'll run through those. So data security, obviously one of the most important things, and this is it's a weird interest to have, but it's kind of my specialty, is the data security and data privacy rules, particularly around health data. You want to be choosing a research tool or a survey tool that applies to the relevant privacy standards. And in Australia, that would be the Australian Privacy Principles, and we also have our Health Information Act. There's state level privacy guidelines, and there's also federal government guidelines as well. You may have heard of HIPAA. That's the US version of the privacy. GDPR, which is a European standard as well for storing data. Data encryption, I'm sure no one wants to go too much into the techie side and the IT side of data being encrypted. That's probably, after I've already made that Select survey, that's one of the things that I don't like about something like select survey when passwords aren't stored in an encrypted form. Considering the type of data we often collect in survey tools, we want to make sure that it's all protected. Our security, we want to have really good user access control. And this is going to come up in a number of our different points when we analyze survey tools. So we want people to have project-specific access and roles. So just because they have access to the program, to Qualtrics or Question Pro or REDCap, we want then user rights to be just project-specific to a database or bunch of surveys in there. And then also within a project, we'd like them to have role-based permissions. So we can limit what users do in our projects. We can give people read-only rights. We can limit individuals from exporting our data. Or REDCap is very well set up for, if you highlight certain data as identifiable bits of data, you can prohibit other collaborators that you add to the project. You can stop them from being able to view it, or maybe you can let them view it, but you can prohibit them from actually exporting anything identifiable. So that's one of the major things we're going to look for in terms of data security for our survey tools. And data storage location, look, we are looking for local storage only, is just a good general rule to go by. Institutionally provided tools are generally more likely to be local storage. Something like REDCap, the way it operates is that it's stood up by your own institution, your university, your health district. There's a Ministry of Health instance of REDCap as well. It uses all your own infrastructure, so it's not sending the data somewhere else for storage. Your Qualtrics and Question Pro type setups are generally, when you sign up for an enterprise agreement, will be hosted at your institution. It's one of those ones that's worth checking though. I used to be associated with the University of Newcastle, and we had 2 Qualtrics setups. One that could collect health information, and its data center was in Australia. And there was actually another one that was used in business and law its data center was actually in the US. So while it was permitted to collect some research data, wasn't permitted to collect any health data on it. And the reason being that we want to check our local storage is generally our ethics and our governance tell us you need to store this locally in Australia. And particularly with health data, without express written consent, if you use something that is stored overseas, you're not only potentially breaking your ethics and your governance approval, it's actually illegal to send Australian citizen health data offshore without consent of that individual. And not many people would be doing that kind of thing maliciously, but using something like a publicly available free survey tool, or using a tool with like a SurveyMonkey or your Google Forms or Microsoft Forms particularly with your own personal logins, you don't get that level of choice where your data backs up. And a lot of the time it's being sent to Europe, Asia, and the US, common places for all that data to be backed up. Worth mentioning as well, it's the same kind of thing for transferring data as well. That's another thing I spend a lot of my time on. Not using public free clouds to transfer data. Use institutionally provided options. OneDrive's institutional provided OneDrive. There's things like Kiteworks as well. Anything that is free, or you sign up and grab a Dropbox account with your Gmail, you don't control where that's backed up. So that's a very important principle to follow. So ethics and governance. Some things we want to choose when it comes to ethics and governance is, where possible, it can support an electronic consent process is really good. Qualtrics Question Pro can do that kind of thing. You can build a consent process through there. REDCap certainly can as well, set up with its own e-consent module where all these tools you can create your participant information statement, create the ability for your participant, because we always have to give our participant the opportunity to keep a copy of the participant information statement. We can do that in these tools. The person can read it, they can agree to it, and they can sign electronically as well. And that can be with a signature pad, a finger on an iPhone, a finger on an iPad, click of a mouse, all that kind of stuff. You can actually capture those, and that is sufficient for informed consent for ethics as well. REDCap with its e-consent module also archives a PDF copy of the signed consent, so it can be produced at any time. Nice thing about an electronic consent process as well is that it's keeping everything in the one place as well. We don't have some filing cabinet in our office that has all the signed consent forms for our project where we collected all our data in Qualtrics or REDCap or somewhere electronically, and we don't have to worry about those two. We also want really good audit capabilities. This is one real huge advantage that REDCap has. It has a full auditing and logging capability for front-end users, for the owner of the project. So it doesn't require IT knowledge to go in the background and look at things that have happened to the database. You have full view of, you can see when someone logged in, what they changed, if a survey was completed, if some data was uploaded. You get all that full logging and can access it at any time, which is really, really helpful for, if any issues come up, in with data quality or security, you always know what's happened. You also want a tool that aligns with your institutional ethics requirements. Again, I'm going to harp on about that role-based user access is very important, and REDCap is one of the best at that. You can still achieve those in other research tools like your Qualtrics Question Pro, where by separating surveys, so having all identifiable data in one instrument or one survey and non-identifiable data collected on another one, and only sharing that with particular people. REDCap has a similar setup, but you could do that within an instrument as well. It has the concept of flagging something as an identifier, and then you can apply rules to those identifiers, whether they're one entire form or it's just a couple of variables that you've created on the form. Now, function and flexibility is kind of, it's a bit hard. I didn't put these in any particular order because they're kind of all important. You can't just ignore one, because the best tool that's the easiest to use and has everything, if it's not available to you locally and they don't store their data correctly, then the function and flexibility doesn't override your data security and your ethics requirements. But the kind of things you're looking for, and these will be sort of standard in any survey tool, is support for like complexities like conditional and branching logic. So that kind of stuff where you're filling out, I actually filled out a physical Medicare form the other day for the first time in I don't know how many years. And it reminded me, it has all those things where it says, if you answer yes here, jump to question 9. If you've hit no here, jump to question 12. You want a survey, an electronic survey tool that does all that for you. So makes those decisions. If someone has hit yes here, just don't show them the next 3 questions, or automatically move them to the next question they need to do. All sort of paid survey tools do that. Your forms and Microsoft Forms and Google's and SurveyMonkey, that will often give you the ability to hide or show a question, but other more dedicated survey tools will give you the ability to jump whole sections or reorder sections and do things in different ways. Really important capability possibly is offline data collection. It used to be really, really important, say 20 years ago, when you have all the black spots in hospitals and of Wi-Fi, or the hospital didn't have its own Wi-Fi going for everyone to connect to, and you needed the ability to collect, if you were collecting electronically, you needed to be able to do it offline. You can do that with, or Qualtrics has its own application where you download, same as REDCap, you can download an app to a phone, to a iPad, enter that data, offline, and then when you are back on network, sync it back up. And not just with an app, but if you have, spreadsheets of data that you pre-collected or are bringing in from somewhere else, like an export from another EMR, you want the ability to be able to bulk upload that kind of data as well, not have someone, you don't want to pay someone and use their wage to sit there and type numbers in forms for days on end. Support for multilingual surveys is really important as well. And lots of survey tools now are offering that kind of as a default functionality. Important to know, for instance, like REDCap has multilingual functionality where someone can select their language that they'd like the survey in. These aren't translation tools. You still need to get your translation done by an appropriate qualified interpreter. They're not designed to actually read and go, okay, I'll put this in German, I'll put this in Mandarin. Okay, they have the capability, but you still have to do that work and say, this is the Mandarin version or this is the Cantonese version, etc. You really want mobile and accessible design options. I'm going to show a couple of examples at the end, but that's quite often where the criticism of REDCap comes in. Because if anyone has just used REDCap as a beginner, when you log in, it's really grey and it's really ugly and it puts a lot of people off. But for the end user's experience, it can be as good as any other instrument. So that's a really important choice as well. So Qualtrics and your Question Boat will default to have mobile views, and they all have their preview of a mobile view. Most people these days are doing these surveys on mobiles or tablets. So, when you're testing, you have an option to flick over to, mobile phone view on Qualtrics and it will show you what it looks like. Something like REDCap doesn't have that, but if you use a browser like any Chromium browser, like Edge or Chrome, for instance, you can actually tell your browser, can you display this to me as if it was an iPhone SE screen, and it'll actually show you what your surveys or whatever your website is, what it will display like on a mobile phone. So that's a little bonus. You get that by pressing F12 on your keyboard. You want a survey tool that can sort of deliver and receive information as well. So you may want to not just be using this survey tool to get your respondent to answer, however many questions. You might want to give them information. And again, in a couple of these examples I'll show later, we're using REDCap a lot more as a digital intervention as well, where we're sending information to participants or patients, like giving them educational videos to watch inside a survey. Sometimes, it's give them a video and they have a little quiz on a couple of things. Or, you provide them information for an upcoming appointment, things that should be covered, and give them the opportunity to write some notes as well to say, these are the things I want to ask about. And in one of these projects specifically, we have that information gets stored and actually gets sent to the participants' care team the day before their appointment, and so they know what to address in case everyone forgets things in appointments. You want invitations, alerts, emails to all be automated, and all your survey tools can do bulk distributions. Really nice thing. Qualtrics and REDCap both, and Question Pro do have the concept of piping. Take a bit of information like a name. Someone gives you their name, use it somewhere else in another area. Classic example, if you get someone to fill out an expression of interest for your project and they fill out their name, 3 months later when you want to invite them to the research, you can pipe in their name and say, hi, Shaun, thanks for your expression of interest. We're going to start our research study and go from there. In terms of REDCap, it's being specifically designed. It started as a tool for capturing clinical data. Like, it's from Vanderbilt University, developed it and basically went, this is really good. Everyone can have it. So it's not quite open source software. It's licensed, but it is the one tool that's really specifically built for longitudinal research data collection with all the safety and security that health data needs. So for a longitudinal project, I've worked on lots where a participant might need to come in for a check-in for 3 years in a row. And right at the very start, the whole of the REDCap project is programmed to say, when that person registers and they start putting in their appointment dates, go and schedule some invitations and reminders to them a week before their appointments. There's no need anymore for having a separate calendar where you come in on Monday and go, oh, participant 4 is due for their invitation, I better send it, things like that. And you want a survey tool with lots of data quality controls. In terms of that, I'm really referring to validation. So things that can lock down. If you want someone to give you a date, it only accepts a date. If you want numbers, it only takes numbers. And other things like most tools will come with a default list of, it'll accept text, it'll accept numbers, or force it to be numbers, emails, so it wants something at something dot something. You want a tool that has all of that, and all your REDCap, Qualtrics, Question Pro, all those kind of paid servers all have those different types of data quality controls and different ways of asking the questions. Collaboration and user management. Ideally, you'd like something with a multi-user environment. Generally speaking, something web-facing. I'm trying to think. There's not many survey tools you'll find now that install a piece of software on your computer. Most of them are web-facing, where you can have multiple users at the same time. Maybe not on the exact same piece of the project or survey, but you might have 10 surveys in a project, and you can have different users working at different points, or people can log in from wherever they are and collaborate with you. You want something that allows collaboration with colleagues. Any sort of institutionally provided survey tool will do that. But depending on the tool, for instance, REDCap is institution dependent. So I look at it the other day, I think there's something like 7,000 REDCap instances worldwide now. Each one sits alone. So generally speaking, you must have your own account within that instance. So if you're collaborating on a HMRI REDCap project, you'll need to get a HMRI REDCap account, which is fine. Admins can do that kind of stuff and happens all the time. Qualtrics used to have a really strong advantage in this area where you could invite someone to collaborate on a Qualtrics project, and they could have been in another country. Provided they had an account in a licensed Qualtrics instance, they could collaborate effectively with you. But you always want to make sure you can do that. And with individual logins, we never, ever, ever want to be sharing passwords and letting other people log in, because we have an activity log or an audit log of everything. And we want to be able to institute, again, these role-based user rights. We want people only to be able to do what we want them to do in our projects. Integration, you obviously want to be able to use what you collect. Most survey tools, you'll be approaching them, you use them as a data collection tool, and then do your analysis somewhere else, okay? Paid tools like Qualtrics, Question Pro will often have some built-in dashboards, plots that you can use, and they're quite nice. REDCap has some. They're really gross and not really usable, or not something you'd really present with. But basically every survey tool can spit out your collected data in an Excel or a CSV file, everything except CSV files. Lots actually will export in particular formats if you use a particular statistical program. If you're a Stata user, SAS, if you use R, things like that, they'll have a particular format that you can connect with. It's really nice when you find something that is very compatible with visualization tools. Because like I said, a lot of these their core purpose is collecting the data, and you might want to use something else to visualize. We do a lot of visualization in Power BI, and to do that we use the API functionality, so like a programmed function where we can automatically go into the project, pull the data we need, and transform it into like a really nice Power BI dashboard that people can click around and do things, or to whatever your tool of choice is, with Shiny Dashboard, Tableau, all things like that. And like I said before, we want to be able to deliver and receive information, not just from our participants, but maybe from external sources as well. So if we're doing an upload of a bulk lot of data from an extract from another system, we want to be able to integrate and use that API functionality to kind of automatically do it, rather than having someone, the API in effect cuts out that middle process of going to a source, clicking export, saving it as a CSV, having a look at it, and then going into your survey tool, importing it all up and putting it in the right place. That's a really key functionality, especially when you're getting on bigger and bigger projects. Usability, help, and support. Things you want to look for are, generally speaking, is well-supported survey tools. Now, generally we're used to that coming in the form of a vendor-supplied technical support. Your paid survey tools like eQuestion, Quote, Qualtrics, etc. have, your institution or you can sign up and get your own access. You're paying for it, so they will give you that support. They will have help pages and, sometimes, most times chatbots and things these days, but they have someone you can contact, and they come with user manuals. In terms of REDCap, it is again, being this institutional dependent resource. The support you can get is really dependent on the institutional expertise. Some REDCap instances are run like HMRIs, where we have services available to, build things in REDCap where people get the most out of it. Others, if they don't have the resourcing for it, it's, hey, look, it's here. I'll make sure it's up to date for you and you can log in, but that's kind of it. Other places you can go are finding online communities as well to get that kind of support. AI tools are getting okay with some of these things as well, like ChatGPT or Claude AI. Some of these are okay for getting, if you're trying to do something in particular or you can't get some syntax right, that can be a source of help as well to help you out. Now, some costs. Most people will initially think of upfront costs. So how much does it cost to buy a software and get it? All of these, or all of the paid survey tools, generally, they'll have an upfront cost and will have annual fees. And that can be in the form of, you pay X amount and anyone in your institution can log in and do whatever they like. Some will be per user, so per login. If you need 10 people to log in, you've got to buy the instance plus an additional 9 licenses. Some run on per response fees. So if you're running a big project and you are gathering it, they might, first 10,000 responses cost this much and then more and more on top. Another one to consider is the infrastructure and storage costs. And I mean, that's something more that our IT was hopefully taking care of, and making sure our storage, if we're storing large data sets, that it's secure, it's backed up. And the one particular internal management cost is a particular one to consider with REDCap, being that it is, most people say REDCap is free, which it is. If you are a charity or a not-for-profit, you can get REDCap for free, or you can get a REDCap license on the condition you stand it up yourself, you use your internal infrastructure. So the cost of something like REDCap comes in terms of the internal management and the staff you may have to, depending how much you want to invest in it, pay to manage and support your instance. So bit of a global view of all of them in terms of data security. Look, I've been a bit harsh on Qualtrics or Question Pro there. Like it's good if pending the location of where it's stored, it's really good. Okay, it's compliant with all your regulations and is safe to use. REDCap, very, very safe to use because it uses your own internal infrastructure. And that's where it also does the same for any communication. So any of these survey invitations or alerts and notifications to the research team to say, hey, something's happened, uses your own internal infrastructure. So you're never sending pieces of data outside your institution, which is obviously very important with research and even more important with health research. Ethics and governance. Look, yeah, again, Qualtrics and Question straddle that line between really good, well, between basically being the same as REDCap and their own levels being excellent. So REDCap sort of by default is really good for ethics because by default it's got all these abilities and its default behavior is be really secure. Like even if you are not collecting identifiable information, you're sending out emails, you're sending out invitations to a survey to a bunch of emails, REDCap will even default to going, unless you tell me, I'm not actually going to tell you which email belongs to which response. I'll keep it anonymous unless you tell me you need to know. Okay. In terms of your Microsoft and your Google Forms, it's not. It's given it poor. It's not a research tool. Like I said, it does have its place in surveying in our healthcare settings, but not for anything researching. Function and flexibility. Probably the main difference between the paid services and something like REDCap is the starting level of a Qualtrics Question Pro paid survey tool is higher than REDCap in terms of like it delivers a polished product that's easy, drag and drop, point and click, nice looking, easy to build. So it's got a higher floor, whereas REDCap starts at a lower level, but the ceiling for REDCap is much higher because it's kind of institutionally managed. You have the ability to be really, really customizable. And you can get really fancy. Qualtrics does allow it as well about injecting script, so JavaScript, CSS to make the page do different things. So while, yeah, in terms of function and flexibility, the base level of lots of paid tools is higher than, starting out with REDCap and not really understanding how to use it, but REDCap surpasses it with knowledge and training. In terms of Microsoft and Google Forms, they're all pretty basic. They accept basic branching or display, hide or skip. They allow, different data types, but certainly no longitudinal support or capability in those. Other paid survey tools do have the ability to manage a project, a longitudinal project, but it's not as slick or as clean as, say, REDCap is. In terms of our user management and collaboration, it's both of those, all these kind of tools are pretty good, provided you are in the same instance, really. Qualtrics does excel that little bit, allowing cross-institution, but Qualtrics is becoming less and less common with its big price tag that comes with it. Whereas all the other tools will allow collaboration with some caveats like needing particular accounts. Integration and compatibility. Like I said, all of these things can export into different tools for analysis, for receiving data. One interesting thing about REDCap is there are multiple sites in the US. So with SDPR, single digital patient record coming, Epic being a provider, there's lots of sites in the US where a REDCap is connected to Epic. So it is, being fully inside the institution, they can get data back and forth between REDCap and Epic seamlessly. But like I said, the other tools, all these tools have an API. to get the data in and out. With the Microsoft Form or Google Sheets, the default is to pop it into a spreadsheet. It does it automatically, and then you have to do something from there manually to do the data. And if you're very clever, you can get things to automatically pull across and do things from once it gets to that spreadsheet stage. In terms of usability, help, and support, like I said, Qualtrics, question whether any paid product is going to have good vendor-provided support. And I sort of said REDCap's okay, given that it really is institution dependent on what you can get. And look, Microsoft, Google products, all the help you need is kind of out there. Lots of people use them, so there's lots of forums around and things where you can get the help you need. Cost-wise, Microsoft, Google Forms are always included in your part of your institution subscription. REDCap, like I've said, the only real cost is that internal management, whereas your paid survey tools, well, they give you that higher maybe starting point, generally very expensive. Qualtrics is one example, it's quite expensive, and that's where Question Pro kind of came in and filled the hole when Qualtrics got quite expensive. Lots of unis jumped over in the last 5 to 7 years. So a bit of a summary. REDCap, really good for academic, clinical, and longitudinal research. Probably the tool of choice. It's really good because its priority is data security, governance, and ethics compliance. The downside, probably this less polished interface for us as the researcher or the survey designer, because they put all the energy into making it really functional for the end user and for longitudinal research and research workflows. So instead of making lots of pretty colors in the interface, they put their effort into giving it the ability to schedule and time out reminders based on every single individual record in a project. Qualtrics paid tools are really good for projects with a high budget and need quick turnaround. And if you've got limited expertise, like if you don't have the time to spend ages polishing up or building something from scratch, they're quite good tools. And I think that even extends to things like some other institute, like I mentioned the Hope platform early. Like it's good because it's done, it's ready, it's good to go. You don't have the ability though to make as many changes or enhancements. They are really good though for like institutional business operations use as well. That's where they're ideal, because quick to drill up, something like REDCap is a bit of overkill for that kind of thing, even though it can be used. And your Microsoft Forms, Google Forms, really good for quick internal data collection, not research. Really good for sending out that survey to go, where are we having the Christmas party this year? And get people's opinions. Good for, sending out to, I use it for my fantasy football league when we have to decide our rules for the year. That's what it's really good for. Keep research and keep health data out of those tools. Now, as I said, I just wanted to show a couple of quick examples of, this is, if you go into REDCap without any real information or abilities, this is kind of what REDCap gives you. Grays, blues, pretty gross. But like I said, the effort goes into what you can do for the end user. So this is the same survey with inexperience, just go in and have a look at it. This is just with a little bit of work on it. So that looks as good as any professional kind of thing. REDCap does have that ability. And a lot of people see it as a roadblock that, you can't get as polished a product and it looks a bit dodgy. You actually can, even though the default behavior is a bit gray and gross and miserable. This is just done by injecting some JavaScript to make things like the button look really nice and have a nice little shadow, nice background, different colors and all different functionality. The other thing that you can do with REDCap, which we've actually been doing a lot of lately in our team, is using it to create basically mobile apps. Everyone, we find researchers a lot of the time want a mobile app, but app development is very difficult. it's very difficult to get installation and get things. If you want to build an app, you have to get approval to have it loaded into different app stores to get them on phones. We've been creating more of these mobiles focused. These are both REDCap surveys. We've got one sort of more basic, cleaner version, which tracks people through their pregnancy, allows them to record different measurements, write notes. It's got videos embedded in it, and it just functions like an app. Each person has their own homepage, and they can just save that link on their phone, and it appears in an app. And another one here, this again is a REDCap survey. They open up the URL, and it operates and looks exactly like a mobile phone application. That's probably right at the top end of where REDCap really, really, really excels, if you've got the knowledge and the capabilities to do something like that. A couple of things on where to get help on these main ones talked about. So REDCap throughout has lots of instructional videos embedded throughout. The program, like if you're creating a variable, there's a video on variables, you click on it and play. There are online resources available, but they can be varying usefulness because being individually maintained across the world, there's lots of different versions being used. At HMRI, for instance, we upgrade every 2 weeks. So we're always basically within one version of the most current at all times. Other places, I've worked on an instance that was like 7 years out of date. And so you can get, things can be quite different with the online research, with resources. Admins can access the REDCap community, which is a worldwide group of all the administrators, and they can get specific assistance from other admins. That's not open to general users though. And places, I'll give you a bit more information in a minute, like ourselves at HMRI have lots of help available. Your paid services will always have like a vendor tech support site. Qualtrics specifically have this Basecamp through their website, and you can learn lots on there. I'm pretty sure it's still free, and then you can actually do it all and then pay them some money if you want to be an accredited Qualtrics person, if you've done it all. Question Pro will host training for their institutions and enterprise licenses. Individual unis will often have training for what programs they have, and there are external providers. I know a previous employer of mine, Intersect Australia, have Qualtrics training for researchers. Microsoft, Google Forms, they're really open products. There's help from them everywhere. You can find them online. Like I said, HMRI specific, we have 2 REDCap training courses. Clinical Data Management REDCap is open for registration now. It's on the end of this month, but we have an introduction where people can come in and just never have seen REDCap before. Even if you don't even have a login, we will sort that for you for the day and learn how to build. They're all hands-on. It's all about doing things. That's a link to our training catalog as well that has the info for not just REDCap, but all the training, like in vivo, programming, stats, anything you can think of. And so it goes to a contact form that you can put any info, and that'll end up coming to me. So I'll see it. If you want real specific REDCap support, like I said, we do from advice and support. Someone's built a REDCap project and like, can you help me, put the final polish on it, or help me get this to work as I want it to? All the way up to someone gets a research grant and says, I need this built and I want it to look like an app and I don't know how to do it. I want you to do it. We do that kind of stuff as well. And that's the link there. I'll pop all these in the chat too, if you want. Another little side thing is if you are a REDCap user or want to learn more, we're actually hosting the ANZ, so the Australian New Zealand REDCap Con this year in Newcastle. That QR code will go to registration. So there's a day for just users, a day for users, there's time for users and admins and advanced users. It's in person as well if you want to come to Newcastle, or you can just come online for 1 day or 2 days. It's one of the most useful things you can do if you are a REDCap user. I've been, the last 4 years in a row, because REDCap is that kind of free community supported, you can get a lot out of these events. The community is quite a rich source of information, and it's basically a day of lots of people showing cool stuff they've done. Like we've got people demonstrating how they've run clinical trials in REDCap, people who have created fun things or made REDCap do something that no one would think of that's made it really user-friendly. So like I said, I'll pop all those in the chat. That's the end of me presenting. I will let Alex do the little plug for this.
Yeah, thank you very much, Shaun, for the very informative presentation. I think you captured people with REDCap. There's a number of questions around how you customize it to make it look so nice and all that functionality with the app style, conversion or rendering. So absolutely amazing presentation. We will open it up for questions. We've got a bit of time while people think about questions. We'll put in a plug for the next seminar, which will